Hello students, I am here again with another topic. Actually, one student requested me in my comment box to discuss something on bronchopulmonary segment. I know this is a very important topic. Often we ask in the examination and very frequently it comes in the theory examination. What is bronchopulmonary segment? How does it differ from the bronchovascular unit? And what is the applied importance or clinical importance of bronchopulmonary segment? So I am giving a very small description on the bronchopulmonary segment and its clinical importance. And you know, the trachea, it divides into right bronchus and left bronchus. Each bronchus again divides into lower bronchus. This is principal bronchus or main bronchus. This is lower bronchus, and this lower bronchus called upper lower bronchus for the right side, and this is called bronchus intermedius. It gives out one middle lobe bronchus, and this one called the lower lobe bronchus. But on the left side, this principal bronchus divides into upper lobe bronchus and upper lobe bronchus and lower lobe bronchus. Here three: upper lobe, middle lobe, lower lobe for the right side, left side upper lobe bronchus and lower lobe bronchus. This is known to you. Then what happens from the upper lobe bronchus or secondary bronchus? This is primary bronchus, this is secondary bronchus. The secondary bronchus divides into tertiary bronchus. So from the upper lobe bronchus, there are three tertiary bronchus. 1, 2, 3. From the middle lobe bronchus, there are two tertiary bronchus. 4, 5. From the lower lobe bronchus, again there are 5 tertiary bronchus. Then 6, 7, 8, 9 and 10. So all these are tertiary bronchus. This is primary, this is secondary, this is tertiary. So all together there are 10 tertiary bronchus on the right side. And similarly on the left side you will get 10 tertiary bronchus. From the upper lobe bronchus there are 1, 2, 3, 4, 5. The lower lobe 1, 2, 3, 4, 5. So this 1, 2, 3, 4, 5, then 6, 7, 8, 9, 10. So for both the lungs, right lung and left lung, you will get 10 and 10 tertiary bronchus. And this tertiary bronchus will supply a particular area of the lung, like this. That means this tertiary bronchus will supply this one, this tertiary bronchus will aerate this one, and this number 3 will be supplied by this tertiary bronchus. And similar thing happens in these 4, 5 and all other remaining tertiary bronchus. They will supply the air into a particular area of the lung, and that particular area is pyramidal shaped and the base is facing towards the surface. This is the surface of the lung. So base towards the surface and apex towards the center. And in between these two adjacent area, this area is called the intersegmental area. So this is called one segment, 2 segment, 3 segment, and these segments are called bronchopulmonary segment. Because this bronchus, and it is tertiary bronchus, it is supplying a particular area of the lung tissue or pulmonary tissue. So it is called bronchopulmonary segment, and it is an independent functional and structural unit of the lung, pyramidal in shape, base facing towards the surface and apex towards the center. So if you are asked what is bronchopulmonary segment, by definition it will be, it is a pyramidal shaped or wave shaped independent functional and structural unit of the lung supplied by one tertiary bronchus. And how many segments are there? In the right lung, there are 10 segments and they are named as apical, posterior, anterior, for the middle lobe, lateral medial, for the lower lobe, again apical, anterior basal, posterior basal, lateral basal and medial basal. On the left side, as because there is no middle lobe here, for the upper lobe bronchus there are 5 tertiary bronchus and they are called the apical, posterior, anterior, superior lingular and inferior lingular. The superior lingular and inferior lingular, these two bronchopulmonary segments, they correspond with the lateral and medial bronchopulmonary segment of the middle lobe of the right lung. So there are 5 bronchopulmonary segments on the upper lobe of the left lung, and for the lower lobe of the left lung, again there are 5 bronchopulmonary segments similar to the right lung. But sometimes for the upper lobe, apical and posterior, they join together to form a single segment, that is called apico-posterior segment. In that case, the number of segment may be 9. But what is bronchovascular unit and how does it differ from the bronchopulmonary segment? If I show you one bronchopulmonary segment, and let me erase this part just to show you one bronchopulmonary segment. Suppose I am drawing this one here. Suppose this is one bronchopulmonary segment. Is a pyramidal shaped and has the apex through which the tertiary bronchus enters into the bronchopulmonary segment like this, and it again divides inside the segment into different branches up to the alveoli. And this bronchopulmonary segment, this tertiary bronchus will be accompanied by a pulmonary artery. Suppose this is pulmonary artery, and another one is bronchial artery. So this is bronchial artery, this is pulmonary artery, and this is tertiary bronchus. But adjacent to this, there is another segment like this. It also contains all the 3 structures like the bronchial artery, then pulmonary artery and the tertiary bronchus. These 3 are the main contents of each bronchopulmonary segment, and in between the 2 adjacent segments, this area is separated by the areolar septum. Like this, areolar septum. This septum contains pulmonary vein. This one pulmonary vein, red color because it carries the oxygenated blood, and this vein is a tributary coming from the adjacent sides of the bronchopulmonary segments. That means this particular vein, it receives the venous blood from the adjacent bronchopulmonary segment. So the drainage area of this particular intersegmental pulmonary vein is this one, suppose. So one pulmonary vein, it receives blood from more than one segment. It is getting blood from this segment also and partly from this segment also. If you get another pulmonary vein is here, this vein will receive venous blood from this segment and another from this segment. So pulmonary vein, it is intersegmental in position, in between the segments, intersegmental in position. But pulmonary artery, it is intrasegmental. It is intersegmental, it is intersegmental. So if you are asked, what do you mean by bronchovascular unit or bronchovascular segment, your answer will be the area of the lung drained by an intersegmental tributary of pulmonary vein. This is the bronchovascular unit. So main difference is that the bronchopulmonary segment, it is the area of the lung supplied by one tertiary bronchus accompanied by the pulmonary artery and bronchial artery. But the bronchovascular unit is that the area of the lung drained by one intersegmental tributary of pulmonary vein. When you are going to resect one segment, suppose you are going to resect this segment because of some disease of the segment, so you have to remove the segment from this segment, from the septum. So this segment is removed, but during the segmentectomy, this intersegmental pulmonary vein may be injured, which may give rise to severe hemorrhage because of injury of the intersegmental pulmonary vein. Because when you are going to resect this one segment, that means you are going through the intersegmental septum where there is one pulmonary vein, tributary of pulmonary vein. So that vein may be injured during segmentectomy because of this. And another term is there called lung unit or respiratory unit, lung unit. Lung unit. What is it? Actually, I am going to draw one bronchial tree. Then it will be clear what is lung unit or respiratory unit. Suppose this is one trachea, then principal bronchus, then upper lobe bronchus and lower lobe bronchus. Of this side, suppose I am discussing on one side. This tertiary bronchus, again primary bronchus, secondary bronchus, then from there tertiary bronchus. From each tertiary bronchus again going to divide, and these are called the pre-terminal bronchiole. Then from the pre-terminal bronchiole, that is terminal bronchiole, again from this called terminal bronchiole. From terminal bronchiole, suppose this is one terminal bronchiole, another terminal bronchiole, another terminal bronchiole, another terminal bronchiole, it again going to divide. This is called respiratory bronchiole. So area of the lung which is supplied by one respiratory bronchiole, this one, these are all called respiratory unit or lung unit. Respiratory or lung unit. So if you are asked what do you mean by respiratory unit or lung unit, the answer will be the part of the lung tissue supplied by one respiratory bronchiole is called the respiratory unit or lung unit. So if this is the tertiary broncha, this one, so everything within this. So everything happening within this one bronchopulmonary segment. Then what is the fate of this respiratory bronchiole? The respiratory bronchiole, if I draw here, the respiratory bronchiole again, respiratory bronchiole, it divides into alveolar duct, which again divides into atria, which again divides into air saccule, and ultimately ends into the alveolus. So the whole portion, this whole portion within the lung unit, because this is respiratory bronchiole. Respiratory bronchiole means lung unit. So within the respiratory bronchiole you will get all these different subdivisions. All are A. A means alveolar duct, A means atria, A means air sacules, and A means alveolus. And it will be surprising, in one lung there may be more than 2.5 lakhs lung unit is there in each lung. So today we came to know the three important terms: bronchopulmonary segment, bronchovascular unit or bronchovascular segment and lung unit or respiratory unit. And importance is that particularly in the bronchopulmonary segment, here is a partition between the adjacent bronchopulmonary segments. This partition or septa, it prevents, it acts as a barrier to spread of infection from one segment to the other, excepting the tuberculosis and malignancy. Besides these two conditions, other infections may spread from one segment to the other and involve the adjacent segments. And if you are going to resect the segment, there will be a chance of profuse hemorrhage. If any applied question comes, why there is profuse hemorrhage during segmentectomy? The answer will be, during segmentectomy, you will approach through the intersegmental septum where there is one tributary of pulmonary vein which may be injured, and that might cause the profuse bleeding. That is the answer. And another applied question usually comes in theory examination or maybe asked in the practical examination. Lung abscess or aspiration pneumonia usually occurs in the segment 2 and segment 6. Segment 2 means the posterior segment of the upper lobe, and segment 6 means 2 and 6 is in the upper lobe, and 6 means is the apical segment of the lower lobe. It is the upper lobe. It is the posterior segment. The nomenclature of the segments are fixed. So in the upper lobe there are 3 segments, apical, posterior and anterior. In the lower segment, there are again 5 segments: apical, anterior basal, posterior basal, lateral basal, medial basal. So among these all 10 segments, there are 2 segments which is called posterior segment of the upper lobe and segment 6 or apical segment of the lower lobe. These two segments are very much prone to aspiration pneumonia because these 2 segments are the dependent segments when a person is lying down position. How? So main reason is that the direction of the tertiary bronchus is very important. If a bronchus goes posteriorly stated like this is the tertiary bronchus, this is the secondary bronchus. So this tertiary bronchus, this red one, going behind when a person is standing, but when it is lying down, it is going like this. So now this becomes inferior. So the direction is towards the bed. So now this segment becomes dependent one. So for this segment 2 or posterior segment of the upper lobe and apical segment of the lower lobe, these 2 tertiary bronchus, their direction is posteriorly. During lying down position, this posteriorly directed tertiary bronchus becomes inferior or becomes towards the bed. That means it becomes dependent. So the infection or aspiration might be collected in these 2 segments. So that is the reason why the segment 2 and segment 6 of the lung are more prone to be affected by the lung abscess or aspiration pneumonia. So direction of the segments are very important because it helps in postural drainage of the infection. So that's all for the bronchopulmonary segment and the other segments of the lung. Thank you very much.